The next recommendation for lowering hemoglobin A1C is lowering average resting heart rate. This is the study. It's available in PDF format in the resources section for this course. The study was published in the journal International Journal of Epidemiology, which has an impact factor of 7.70. Any journal with an impact factor of 3 to 9 is considered good. The study was published in June 2009. It was a prospective cohort study including over 25,000 adults. The median follow-up period was 8.2 years. Let's look at the results. The researchers found that for men, having an average resting heart rate of 53 or less led to the lowest risk of developing diabetes in the follow-up period. For individuals with higher heart rates, risk of diabetes was greater, and the higher the heart rate, the higher the risk. Same findings were found for women. With a resting heart rate of 57 or less, there was the lowest relative risk for developing diabetes among women in the follow-up period. As the heart rate increased above 57, the relative risk of diabetes increased for women during the follow-up period. When we consider the literature on diabetes risk, it looks like for men, optimal heart rate is 53 or less, and for women, optimal heart rate is 57 or less. If we look at the mortality data on average resting heart rate, then anything under 60 is optimal. So for general purposes, for overall health for the general population, I recommend an average resting heart rate under 60. But if your hemoglobin A1C happens to be 5% or greater, I recommend an even lower goal of 53 beats per minute average for men and 57 for women. If your average resting heart rate is elevated, and you can determine your average resting heart rate using a wearable fitness device like Fitbit or smartwatch, then I recommend you take this online course to learn about how to lower your resting heart rate.